afternoon, everyone. I'm Lauren Sansing, ISC Chair 2026, and we just heard two exciting presentations of trials that are sort of readdressing that middle and distal artery occlusion patient population with looking for what selection criteria and efficacy of benefit for thrombectomy. So we had one clinical trial that was performed in China. That one was presented by Drs. Jing and Noguera. They were sort of agnostic to device, but patients had to have a non-dominant or codominant M2, as well as an M3 ACA or PCA occlusion. The other trial was DISTALS that used a very specific Tiger Triever 13 device that was designed to be adjustable and to the size of the artery, really aimed and designed for a smaller artery diameter. And that was presented by Dr. Gupta. Both of them had some signs of promise. So we know that last year we had 3 negative trials looking at this patient population. It seems like we're moving more towards better patient selection. We need mismatch on imaging, as well as, again, distals use the same arterial inclusion criteria with non-dominant M2, M3, ACA, or PCA, but really trying to select devices that are meant to be in smaller arteries, select the patients based on CTP, looking at patients that have these sort of middle or distal artery occlusions, but still have some significant deficits. So the Tiger Triever 13 trial, that's distals, presented their recanalization rate success, which was 85%, quite significant at 24 hours with successful reperfusion of the hemisphere. They're still collecting their modified Rankins at 3 months, and so we should have that clinical data in March. And so obviously a lot of attention on whether that recanalization rate in this patient population is going to translate into a clinical benefit. So hopefully we'll hear good news soon. And then the study in China presented a higher increase of patients that had a good outcome, a modified Rankin scale score 0 to 2, showing benefit in intervention in the patients with MEVO. So that's it. More promise on the thrombectomy front and more to learn when we see the full data sets. Thanks so much.